Hip replacement is generally done for patients with advanced hip arthritis. It can be done for other conditions, like if patients have broken their hip and has been fixed and the fixation has failed, or people have some blood supply issues to the hip joint, etc. But the commonest reason for getting hip replacement is for hip arthritis. So if you're suffering from hip pain, if you're suffering from stiffness in your hip, if your walking distance is limited and you're struggling to put shoes and socks on, and essentially your quality of life is affected, this would be a sign that you would be better off seeing a hip specialist, getting some investigations done like an X-ray or sometimes a CT scan, and then with that the diagnosis can be confirmed. And after that, hip replacement option, if it's viable option, is considered, and I discuss that with my patients. Hip replacement is one of the most successful operations ever. Generally, the success rate is about 90 to 95% in majority of the cases, and it is indeed a life-changing operation. It certainly helps improve the quality of life for vast majority of the patients. But there's no taking away the fact that it is indeed a big operation, and hence there are risks. There's a very slight risk of infection, but we try and mitigate that by doing the operation in an ultra clean air theater. We give patients some antibiotics before and after the operation. And by taking these precautions, we generally minimize risk of infection. There are some other risks like clot in your calf or clot going to your lung. And again, we try and minimize that by giving blood thinners to the patients. And there are other small risks like nerve damage, dislocation, or leg can be slightly short or long. But in majority of the cases, patients' functional outcome improves substantially. The average life expectancy of a hip replacement is around 15 plus years. So these days, what we have is joint registry data. So every single patient who undergoes a hip replacement, that data is generally submitted within UK on something known as a National Joint Registry, NJR. And looking at that data, plus also looking at registry data from worldwide, and also any long-term studies from other units, we can see that about 90 to 95% of the hips are still functioning at 15 plus years. So this is typically expected when somebody has a hip replacement and it's been functioning well for a few years. As I just said before, it could be a good 10 to 15 years, if not longer. After that, if it starts to give you problems, for example, if it starts to give you pain, which wasn't giving you before, or sometimes the hip dislocates after a few years because the cup of the hip has worn out. So these are the two common reasons when, if you are having problems from your previous hip replacement, you would want to consult a hip surgeon, get some tests done, and then see whether or not revision surgery is indicated. Okay, so typically a lot of work is done preoperatively when you would see a physiotherapist, you would see the pre-op nurses, you would see the anesthetist. So a lot of that planning happens beforehand. Any equipment that you may require post-operatively, for example, any toilet seat trays, etc., is generally provided to the patient beforehand as well. Then you generally come in on the day of the surgery. You're in hospital for either 1 or 2 nights, depending on your recovery. Very occasionally, you may need to stay in for longer. After that, generally before you go home, the whole team looks after you and you mobilize generally with crutches. The physiotherapist makes you do stairs as well. Make sure you can get in and out of the bed independently. You're independent in dressing up, etc. So generally after your hospital stay, once you go home, most patients are on crutches for anywhere up to 6 weeks. And after that, you're generally able to mobilize independently. You're generally able to drive around that 6 weeks mark. And you're hopefully able to resume most of your day-to-day activities. By about 3 months, most patients have almost fully recovered from the surgical pain, and your strength is back, and you're back to doing all your normal stuff, including gardening, etc. And by 6 to 9 months, your x-rays, everything generally show that the hip's fully bonded in and you've almost fully recovered from a hip replacement.